Good morning, I'm Terry, and you may recall that I made a Phase 1 video back in December of 2014. I actually came back to San Antonio, traveled back for my Phase 2, and so that's what we'd like to talk to you about this morning. Phase 1 is a huge surgery, and there's tons of stuff on their website about that, but we thought it was important to address Phase 2 and some of the things that you can expect from that, because I have had some talk to some ladies and they've asked about it. So we'll go over some of the things that you have to do for Phase 2. The prep is easier for this one. You might recall that you had to refrain from caffeine, chocolate, alcohol consumption, some of your medicines 2 weeks out of your first DIEP flap or your Phase 1 DIEP flap. For this one, it's only a week before and a week after. The test that you have to do, unless your doctor orders something differently due to your specific health concerns, you probably will only, like me, have to have a CBC and a CMP, which is a complete blood count, complete metabolic panel. The prep is they put the leg compression on you like they did last time. You will be intubated. My voice is still a little scratchy from that, so if I sound a little hoarse this morning, that's why. If you go in the morning, chances are you're going to be back home, or like me, since I was from out of town, you'll be back in your hotel that evening, because they put you on what they call a same-day surgery or a 23-hour observation. And for me, when I got out of recovery, I went up to a room for maybe 2 or 3 hours, and they monitored me, gave me a little bit of food, checked your vitals, and I went back to my hotel that night. So kind of advantageous, because you can get up and walk around when you want to. Otherwise, if you need to stay in hospital overnight, they will give you that 23-hour observation watch, and then you'll go home, within those 23 hours, so pretty easy. As far as after surgery, I would bring your t-shirts that split down the middle, because I still have on my surgical bra right now. I didn't get the abdominal binder this time. What I got was, it's more like a body compression, and that will depend on where they take the fat and the liposuction for the contouring, because this is the contouring and symmetry part of your breast reconstruction. And so my surgeon, Dr. C, took some from my thighs, and quite a bit from my thighs, so I have more of a body compression suit on to help minimize the swelling, and it does kind of start down below my knees and go up above, right below where my bra is. As far as pain, I've taken a couple of pain meds at night to help me sleep. The pain with this surgery is different than the first. I had very little pain in the first surgery. With this one, I just feel like I've been to the gym for a very intense workout. And hey, ladies, you've been through Phase 1, so you can handle this pain, trust me. And even today, I had my surgery on Friday, and today is Monday, and already I'm feeling less of that gym workout pain than I did the first or second day after surgery. So also they'll be doing scar revision. And I've got some little touch-ups, the dog ears on the side of your abdominal incision they will take care of. And there's a couple of other places they might touch up some scars and close up some of the flap area that they did before. So when you get out of surgery, you'll have maybe some tape or Dermabond over those just for added protection, and that will come off naturally in the shower after 2 or 3 weeks. You just leave that on for added protection. I would recommend, if you are traveling, I would recommend staying at least an extra day after your surgery. I wouldn't recommend flying home the day after, because you will be tired and you will be sore. So that's just my personal recommendation. Drink lots of water, of course, Eat a healthy diet when you get out. Get up and walk. I'm telling you, when I was up walking, I felt far better than when I'd walk and then I'd sit down for a while and try to get up again. That's when you feel sore and you feel that stiffness. So walk at your own pace, but don't overdo it. My lovely sister, she's sitting to my left right now. She came and helped me. And I think we got a little overzealous the second day and went out and did some sister shopping. And I think I paid for it the next day. So do walk, but don't overdo it. Just go at your own pace. I'm going to wrap up again by saying that PRMA has been such a wonderful experience for me. I have, you know, when I think back a year ago, I had this mastectomy and I was without my breast. I have a new body today. My feminism is back. The education and confidence that I gained from joining with this group as a patient volunteer advocate has just, I mean, it's turned my life around in so many ways. And I encourage you to reach out to other women, because there are those women that will talk to you about their experience, and I will continue to advocate for PRMA because they are so worth it to me. They've done so much for me, and I thank them from the bottom of my heart. Dr. Christopoulou, I don't know what else I can say to you that I haven't said already. You are a legend. Thank you so much.